Congressional lawmakers have put forward a new proposal to establish national standards when caring for sexual assault survivors. Our Natalie Brand speaks to one survivor who inspired the legislation.
In 2014, I was raped, and I went to the closest emergency room. They looked at me and shrugged their shoulders and said, "We don't do rape kits here."
Leah Griffin's case was never prosecuted, but she's fighting for justice of a different kind to make sure hospitals everywhere have rape kits and the trained nurses to administer them.
We don't know how many survivors walked away from a hospital and then didn't report.
Griffin, who lives in Seattle, Washington, reached out to her senator, Patty Murray.
This problem is the same in every big city, in every small community.
A Government Accountability Office report in 2016 requested by Senator Murray found glaring gaps in the system, a severe lack of data surrounding this issue, and a shortage of resources, especially in rural areas.
Victims just give up.
Senator Lisa Murkowski of Alaska says in some parts of her state, it requires a plane ride to get help.
That woman is told, don't bathe, don't change your clothes, sit here until we can arrange for a flight out.
Murkowski is now a co-sponsor of Murray's bill, the Survivors Access to Supportive Care Act, making the effort bipartisan. The legislation would study the problem nationwide, establish national standards of care for survivors of sexual assault, and aims to expand access to services, including the specialized nurses who administer rape examinations.
What I'm hearing from hospitals is, well, there's a cost. Yeah, there's a cost. But there's a cost to every individual who is raped or sexually assaulted and doesn't report, doesn't get their health care, and doesn't get justice.
People really understand that this is a problem, and it's not a controversial one. If a rape survivor goes to the hospital, she shouldn't be turned away without access to evidence collection.
Years after it happened to her, Leah Griffin says she'll keep working until the system changes. Natalie Brand, CBS News, Capitol Hill.
The International Association of Forensic Nurses reports that only about 17 to 20% of the country's hospitals have specialized sexual assault nurse examiners on staff.